A 6-minute walk test is exactly like it sounds. It's a walk test for 6 minutes, and we are specifically looking at markers of your endurance, so how far you can walk, and we're using this to track your changes over time. So this is why this test is usually done before seeing your doctor, and it's usually done in a hospital or a clinic setting. The other number that's very important to us is your oxygen saturation during the test. So we are looking to see what the levels are as you progress through the 6 minutes, and if they drop significantly, we would use this as a marker that you might need home oxygen for physical activity. So a PFT is a pulmonary function test, and this is a measure of your lung function. It's probably the test that you remember doing at the hospital or at the clinic, where the first part is breathing out as fast as you can, and the second parts are where they put you in a body box, and we are specifically looking at your lung volumes, which helps us get a sense of if the scarring or the fibrosis of the lung has affected your lung function. And we're also looking at the oxygen's ability to transfer into the bloodstream based on another one of the numbers that we're checking in that particular test. So it's very helpful for us to get a sense of your lung function at that particular point in time, but also how your lung function may or may not change over time. So an HRCT is a high resolution CAT scan. So this is a type of a picture of the lung that we find very helpful, both for making the diagnosis of scarring of the lung, as well as helping us determine potentially the cause. So we rely very closely on our radiologists that read these CAT scans, and they help determine the pattern of the scarring, which we use to influence the treatment that we might decide to put you on. So an oximetry is what we use to check the oxygen saturation in the blood. So it is a small probe that we put on your finger that tells us what your oxygen levels are. And usually when doing your walk test, for example, we would have this oximeter on your finger, and that's how we're recording your oxygen levels during the study. And as I mentioned before, this would be to help determine if your oxygen levels are going too low, and if that were to be the case, if you would meet criteria for needing oxygen at home.
Well, thank you, Dr.